Day 15 of the 27-day mobility challenge here at the Reprogram, and we are talking prerequisites. We are going through these assessments that you can do at home to assess whether your joints are functioning in a healthy way, whether you have that compensation space, that passive range of motion necessary to A, minimize your risk of injury, and to, if you are going to get injured, minimize the level of damage. Okay, so as mentioned before, it could be the difference between having a muscle strain or a complete tear. Okay, so today we are moving on to shoulder extension and internal rotation. Yesterday we did shoulder extension and external rotation. And when we see people miss, this is quite a common one, and a lot of you will find this hard. What we find is when we're missing this internal rotation, this essential internal rotation arc here, is that the posterior capsule gets a bit stiff, and it can result in a bit of a thickening of the tissue, and it leads to things like posterior capsule impingement. It leads to neck muscle strain and neck pain, tightness, because when we lose that ability to internally rotate the shoulder, that internal rotation has to go somewhere, and we end up hitching up here, and it starts messing. The compensation starts messing with our neck muscles, and we also it can actually lead to rotator cuff tears as well. Absolutely, when we're missing that internal rotation, and let's take the movement like a dip, for example. When we're going to that low position, if we're missing that ability to internally rotate as the shoulder extends, that we have to go like this, but the bar doesn't move, so the next thing to go is the shoulder, and then that's where we get those problems, those rotator cuff tears, those rotator cuff strains. Okay, so the movement we're going to do is basically just a shoulder extension and internal rotation test. It is a modified version of the Apley's scratch test, and it's actually not modified. You can do exactly the same test as I would do in clinic with you, and you can do it at home and test your shoulder health. So here we go. All right, so this is the Apley's scratch test, okay? No modification needed. You can do exactly the same test as I would have you do in clinic by yourself, and hopefully answer a few questions into your shoulder health, okay? So here we go. So I've got to turn my back to you for a second. I apologize. But it looks like this. So you're going to sit with your legs crossed in this position, okay? And what we're going to do is, your idea is you have to get your fingers to touch each other. Okay, so that's a pass, and then the other side, that's a pass. All right, again, touch my fingers, touch my fingers. All right, and that's it. So pretty quick one today. A fail again would obviously look like miles away from touching. Basically, if you can't touch your fingers together, that's a fail, and then obviously, if you go onto the Reprogram, I will teach you how to improve that mobility. And as always, remember that it's not necessarily true that the exercises I use to screen these movements are the same ones I would use to improve the mobility, to improve the range of motion or improve the mobility. These are just screening tools. Some of them you can, obviously, you can moderate them, but a lot of them require regressions to allow you to actually improve your mobility to then be able to pass them. Okay, so thanks for listening. If you like what you're seeing and you like what I do and you want to find out more, check us out at www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.